Over the last several decades, I have noticed that our healthcare system has evolved into a very transactional conceptualization of the work that we do. But fundamentally, at its core, our work is about relationships. In an upcoming issue of the Mayo Clinic Proceedings will be an article, The Radical Reorientation of the U.S. Healthcare System Around Relationships, Rebalancing the Transactional Model. This is a paper that I co-wrote with Dr. Tate Schoenefeld of Stanford and Dr. Alexandra Risto of Patina Health. And I'm Christine Sinsky, and I'm the Vice President of Professional Satisfaction at the AMA. So what is that transactional model that we've gradually evolved into? It's an idea that's built into our infrastructures, our staffing models, our technology, even our payment system, is based on this very transactional understanding of what healthcare is, that anybody will do. Any physician can round on the patient, any resident can cover continuity clinic. It's all a series of independent transactions or interactions. The idea is that the encounter can be captured by a series of tick boxes and templates. And yet the secret sauce, the underappreciated dimension of healthcare that I believe drives quality, that drives satisfaction, that drives the other outcomes that we look for, is actually the relationships within healthcare. And that the power of relationships currently resides in our collective blind spot. So in this paper, my co-authors and I are hoping to help raise awareness of this dimension of healthcare, the relational aspect of healthcare, not just between the patient and their physician, but between physicians and each other, between physicians and nurses, between nurses and nurses, and even between institutions, between the hospital and the ambulatory clinic, between the hospital and the surrounding community. And our hypothesis is that by prioritizing relationships and the provision of continuity of care, we can more easily reach the quadruple aim outcomes of better health for the population, better care for individuals, lower cost, with greater satisfaction for the healthcare workers within. In the paper, we provide examples of what this model can look like, both from an operational standpoint and from a cultural standpoint. We also discuss the need to remove much of the sludge that's in healthcare, the operational administrative waste that's clogging up the gears of healthcare, if you will, and that by removing some of that sludge, we will provide breathing room for the people within to be able to devote more energy and focus on relationships. But we also know that it's not just up to the individual professionalism of each healthcare worker to focus on relationships, but we need to rebuild the infrastructures to support those relationships so that our technology supports having relationships with each other, so that our physical structures in which we work are more likely to support relationships among the co-workers. There is so much that the physical environment in which we work will impact whether we can have relationships. Are the nurses off in a corner, or are they seated side by side with the physicians? Does the receptionist never know the nurses and the physicians with whom she or he is actually working? Or is there more of a community built by this space? And so we give examples in multiple dimensions of how an organization can prioritize relationships. And then finally, we address finances. We discuss some of the financial strategies that can support relationships within an organization. And we also discuss the finances of healthcare research. We address, for example, the fact that public and private investment in research in this country is about $130 billion annually researching disease-specific treatments. But we invest less than 1% of that amount on how to best deliver those new treatments and new approaches to disease-specific conditions. So no physician, leader, payer, or policymaker can single-handedly facilitate this shift away from a purely transactional understanding of our work to one that prioritizes relationships. but collectively we can each make progress in that direction. And so I invite you to read the paper in the upcoming Mayo Clinic Proceedings issue on the radical reorientation of the US healthcare system around relationships.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.